Hi everyone, my name is Ismawati Ana Perpanlangoi and I am from BM2355A. Now, I am going to talk about medical issue topic 6, which is health information management and technology. Based on the topic, I have found an article which titled Factors Associated in the Implementation and Adoption of Electronic Health Records, or known as EHR in private healthcare. First of all, according to the author, information technology in healthcare refers to any electronic exchange of health-related data collected through an electronic connectivity for improving efficiency and effectiveness of healthcare delivery. They also stated that the electronic health records, or EHR, is a computer-based record of patient health data maintained by a health organization. The electronic health records contain several components such as patient demographics, progress note, medications, vital signs, clinical history, and laboratory results. From the article, there are 3 issues in which it will be discussed later on. Now, these are the 3 issues that have been highlighted by the authors. They are inaccurate patient data, EHR system security, and centralized healthcare system. The first issue, inaccurate patient data. According to the authors, the slow implementation of electronic healthcare records has caused a reduction in the quality in patient care and productivity. Hospitals are esteemed focuses since they are viewed as treasure trove of data that keep up gigantic patient information. For example, personal ID data, similar to social security numbers or places of bank account data, protected health data, which is HIPAA, information and cardholder information. This caused the hackers utilize ransomware to encrypt information, lock computers and hold the data for ransom installment. Nowadays, there is an increased number of hackers and authorized access to patient information globally. The security among software systems is a major problem in developing countries because their systems are not advanced enough to monitor hackers. Hospitals are specifically vulnerable as they have open networks where everything is accessible to everything else on the network. The third issue, centralized healthcare system. Nowadays, the centralized healthcare system lack of predetermined list of standard requirements. In hospital, centralized databases are becoming more efficient as patients are able to receive fast and efficient care through the application of electronic health records, from the ease of accessing patient medical records to electronically sending prescriptions to pharmacies. Each year, millions of people all over the world died due to medical errors that could have been prevented. These medical errors are not only the result of poor medical training, but as a result of poor communication caused by the faulty systems and processes which cause people to make mistakes and fail to correct the situation in time. The driving forces of medical error are that medical professions, doctors and nurses don't use electronic healthcare records to their advantage or don't use them to their full potential. Some doctors and nurses don't have access to this very system at all. There has been a lack of universal EHR implementation around the world. Now, let's move on to the solutions. There are 3 solutions that can be implemented in private healthcare regarding the 3 issues that we discussed earlier. They are health informatics standard, control system access, and physicians and staff management. First of all, the health informatics standard. What is health informatics standard? Actually, it is a standard that helps to ensure health-specific applications used by clinicians, physicians, and citizens are safe, usable, and fit for purpose. These standards support interactivity between systems so that information communicated electronically can be accurately interpreted and used for decision-making, continuity of care, and other purposes. Hence, the person in charge, or in this case, the National Health Informatics Committee, should develop standards, protocol, and other governance issues related to health informatics standards and its utilization. As a result, this creates the potential for coordinated standard development in any healthcare setting. The second solution is control system access. Control system access is the electronic systems that are designed to control through a network, and they should have an access to a network. It recognizes, authenticates, and authorizes entry of a person to enter into the premise, thereby giving complete protection, ensuring security with the system. In a client-server network, where the server that stores the EHR is located on site, the providers and staff access the EHR to their computer network. However, if a practice uses a cloud-based EHR, in contrast, the application and the data are stored on a remote server. Last but not least, the physicians and staff management. It is very important to manage physicians and staff because they are the person who are responsible to handle the patient records. In order to do so, first, we must eliminate confusion among physicians and staff, since all administrative and clinical tasks will be completed electronically. Next, we must train physicians and staff with basic EHR functions and focus on optimization. Lastly, establish a mentorship program that enables staff with similar roles to share their knowledge and experience with the system, rapidly increasing the level of EHR proficiency in the practice. Now, we have come to the end. Overall, EHR systems help in data management, interoperability, information sharing, and decision-making by health physicians. The system also cuts data storage costs, minimizes information loss, and prevents medical errors that result in fatal injuries and deaths. However, there are issues that have been raised, such as inaccurate patient data, EHR security issues, and the centralized healthcare system. Thus, several solutions were proposed, which includes health informatics standards, control system access, and physicians and staff management. For now, that's all from me. Thank you.